the clinic that Myna went to for ALS was pretty remarkable. And I accompanied her on several times because, and what I did, I felt it was really important for the family to take notes. And then I would go home and I would do an email incorporating, because typically when we would go on an ALS day, Myna would be in a room and various people would circulate. So she didn't have to leave. Once she was in a room, she didn't have to leave, but there might be a respiratory specialist, and he would have her do some breathing tests to measure her oxygen levels and how well she was doing, you know, with that. There might be a dietitian who would make some recommendations. There might be an occupational therapist, because who said, you're having difficulty with this. Let's figure out some ways around it to make you be able to be more efficient in the way you're doing things. Certainly the doctor would come in. He had a wonderful assistant, and she would, sit in on some of these things. So as these people came in, I just took notes. And then after the appointment was over and we left, I would do an email and talk about each one of these people and about our visit that day and send it out. First, I'd send it to Myna, and I'd say, is this the way you remember it? If there are any changes, just let me know. I'll make the changes. And then I would send it out to her son and her daughter, my husband, nephew in Colorado who was very interested. Just different family members, sometimes some friends. But so just to keep everybody on the same page, so we knew what was going on. We knew what the recommendations were. And this team of people, I don't know, we went on a Wednesday, and it was maybe every other month. And then they would have recommendations that they would get back probably to the ALS people and also to Myna, and recommendations of things that they felt she needed or would be needing. And it was just, they looked ahead. They knew, what I hadn't realized is how different ALS manifests itself in different people. So what is right for one patient is not necessarily the right treatment for another patient. So these people would get together, and all the experts, and they would just go through patient A, patient B, patient C, and collaborate and come together on a diagnosis or a treatment plan, really, of what they should do moving forward. And so they would do that every couple of months, and that was remarkably helpful.